Bye. Thank you.
Everyone's clear outside. I'm just playing it out.
Okay, thanks so much. Sorry, John, I cut you. I just didn't know if your audio was going to work for that last second, so I just cut right in.
Fine. All
I'm
good, all
so
good.
sorry.
No,
Um,
it's all good. It's all good.
but
Great
I
show.
do, we have so many different, can you stick around for a few minutes?
Yeah,
And, get some other real, good questions in here,
absolutely.
that patients have that we're really excited. I know that Douglas wanted to jump in with a question. Douglas, go ahead and ask your question, and then we're going to go one by one with folks.
So I kind of want to start at the beginning. So if I've been diagnosed pre-diabetes. So where do I start? Where would I begin in that change? And because I struggle with what she says, I do good for a while, and then every now and then I relapse in my eating. So where do I begin to make those effective changes in my lifestyle?
Yeah, if you have weight to lose, it's not easy to lose it, but that's the best thing you can do to prevent pre-diabetes from escalating into type 2 diabetes. And it's mainly the food. And it's hard to cut back on all the starch that is in most people's breakfast, lunch, and dinner. But that's the first place to start, is recognize the starch and the sugar as being the kryptonite to your Superman, and figure out how to make it a special occasion food rather than something eaten daily. That would be my general advice for most people. It's
If
an oversimplification, I understand.
if I was to get somebody to help me, is there a specific person that I should look at to help me figure out all of that?
I'd love to hear ideas from other folks, because there's a shortage of people who can provide that.
There are. And Dr. Michael Dansinger was so generous with his time in the past year, and has actually shared a lot of his amazing expertise in our book called Food for Thought, which is free online. We do have a link that we can put here in the chat. We can put it on YouTube as well. But also it's available on Amazon if you search peripheral artery disease. A lot of his expertise and guidance and education is in that book that he dedicated so much time to doing. Across the board, we tell people to go ahead and ask your primary care physician for a referral to a dietitian. If a dietitian is not available readily, then they do have a nutritionist, and get into a program with that nutritionist. Many HMO or general healthcare systems do have regular educational programs and seminars, even just virtually, that you can attend on a weekly basis, especially for diabetes. And so you can ask about that. But a lot of primary care physicians don't think, right away when they say, hey, you have, diabetes, you're pre-diabetic, to actually offer those resources. So it's up to the patients to advocate for themselves and ask that question. What resources are available for me to help me start improving my diet and getting the guidance I need? Do you have, seminars here? Is there an educational person or resource here within our hospital system or clinic? You also need to give a call to your insurance company, because insurance companies also know of the resources that are specific to that insurance company that they may provide.
And I would also say that it behooves the insurance company to get you healthy and keep you healthy,
Yes.
because your premiums are down, you're quote less of a risk to them. But I also worry that, like this, there's all these little boutique type medicine practices popping up, at least in Columbus, and I imagine in Massachusetts too. And so a lot of this favors those that have the disposable income to go reach out and pay a dietitian to take care of them, or pay out of pocket. But a lot of my patients don't have the ability to use, or to have, they don't have resources such as that. So it is a struggle for folks that are financially a little bit tighter than others.
It's a good point. I'll also point out that about 20% of my patients are Medicaid, and most of them are middle income to lower income. and money always helps provide resources, and but a good it doesn't have to. We this country cannot afford to let the those who need the most help financially behind, and
Right.
there are, I think, searching online for diabetes prevention program near me is probably a good place to start.
And I know that there's an organization called Virta Health, and they have, for other states that you're not in, there's some insurance companies that work with them in particular, and you need to ask your insurance company if they're supportive of the Virta Health program, which is also virtual. I do want to ask a question just following up, and then I'll get to more questions. But, if you, Douglas was mentioning, how it's tough to stick to that diet. But if you cheat, are there any sort of parameters for cheating? Are there rules to having a little cheatery in that general diet? I know that Marcia is going to get to a question that she has, and she has had, been asking at some point, like, can I just have that one pizza? Or Douglas and his one Dr. Pepper Slurpee from Buc-ee's. Are there rules that allow for a little cheating once in a while?
Yes, absolutely. So in my experience, it's very important to have an eating strategy with clear rules. But I would say all of my eating strategies say eat this, but not that. But you only have to be A- or B+ strictness. So 90% strict gets pretty good results, and not everyone can do that. Some people can only be 80% strict, but I never, as a coach, look for 100% perfection, because nobody's perfect. And the goal with treats is not like with smoking, where the goal is 0, or with alcoholism, the goal is to not drink today. With treats, you can't be so all or none, black or white. So I would say there's this gray area, and aiming for 90% strict is what I would usually do with a patient.
Marcia, do you want to ask your question? Go ahead and unmute.
Well, thanks for being here. This topic is very interesting to me. I was just looking at my test results online, and instead of A1C, they're doing EAG. So estimated average glucose.
Yes.
Okay, so I went up from February to April. I went up from 117 to 123, and I eat clean. I mean, I've lost weight, I've quit smoking, and I exercise like crazy. My glucose went down from 114 to 102, but it's still high. And I don't know what to do. Is the two things that I do in my diet is intermittent fasting. So I usually only eat mostly in the evening, and I do like red wine. So those are my questions, I guess. What can I do?
Right. Is it fair to say you don't have any weight to lose?
People are telling me lately I'm too thin. I mean, I can tell you what I weigh. I don't know what the body mass index is, but I weigh 130. I'm 65 almost, and I'm about almost under 5'4".
Yeah. So even though the vast majority of people with type 2 diabetes or prediabetes have weight to lose, 10 to 15% do not. And that makes it much more, first of all, it's puzzling. And secondly, it's much more difficult to reverse that. And so I hear your I hear your pain. And there's still there's definitely a genetic component that's raising, risk there. And we can't change our genetics, but we can all do the best we can with what we've got. And so if a person is eating clean and exercising, and I would say a person, can get as close to 7 hours a week of exercise, which is ambitious, but we should all be trying to get as close to 7 hours a week of exercise as possible. We should all try to be 90% strict with our eating, regardless of whether our state of health. And that's all one can do. And so,
Is intermittent fasting, is that a bad thing? Does it
So-
affect your sugar?
so intermittent fasting, we still have a lot to learn about that, but I will tell you, when in research studies that take a certain amount of calories, let's say 2,000 calories, and they divide those calories up in different ways, spread out evenly versus, lumping them all into, a window of eating. Those studies generally show, so what so if you're looking to lose weight or lower your hemoglobin A1C, I don't think there's that much to be gained by taking the same amount of calories and spreading them out differently. However, you can make little gains by actually spreading out your calories evenly, but more importantly is that when you stop eating, when you close the kitchen at 8 p.m., or when you say, I'm just going to have 2 meals a day instead of 3, or, when you find ways to limit your eating to certain times, that prevents you from eating more calories, and that can lead to weight loss. And so to me, the main advantage of intermittent fasting is it basically closes the kitchen during a certain time of day, and
And
that
that's why I do
causes
it.
you to not eat, because we all eat for pleasure, not just because we're hungry.
Yeah, that's a really good point. And
Red
we
wine,
have a
can you ask about alcohol just real quick?
yes.
I think opinions differ, but I think alcohol is counterproductive for the most part, especially for people who are trying to lose weight, because it has calories and because it's disinhibiting. I would also say that research for many years has suggested that alcohol can maybe help clean the arteries, and maybe there was something in the skin of the red grape and wine or something like that. But I think that research has become less straightforward, and that there's enough contradictory research to say maybe wine or alcohol does not cause any health benefit. And so I don't, I think we need more data, but for the most part, I don't think there's much to be gained by drinking alcohol.
If it is,
Yeah.
go ahead.
You
It's
can definitely find experts who would say, no, a glass of wine a day is good for you, but I would disagree with those people.
for my dad, it was interesting because with the way his dietitian approached his situation, her first question to him was, what is your number one non-negotiable? If I can change everything else in your diet, which I'm going to, what is that one non-negotiable that I am not allowed to change? And I will give you that one, and we will then figure out a workaround with it. And so his number one was he has to have his one little martini every night. It's been a thing with him. He doesn't drink a lot, but he just has his one martini with 2 olives and an onion every night. And she said, okay, you can have that. But along with that, you need to have a protein. So I want you to have a handful of nuts or 2 handfuls of nuts that is paired with that alcohol. Or you're going to have some smoked salmon that is paired with that alcohol, so that she claims that it balances out the sugars somewhat, somehow. But everything else in his life, he had to change.
Great point.
So how much, do you have those situations? Do you have any funny stories in terms of, non-negotiables with people where you're like, okay, boy, oh boy, I have to work around that. Oh, Lord.
I will tell you a story. So there was a time when a patient was not able to have her morning coffee because she was fasting for a blood draw, and she went crazy. She did have some psychiatric problems, but without that, morning cup of coffee, she was just not herself. Let's put it that way. And that was the most extreme version of this principle. But I find that if I'm too, I don't complain about coffee. It's the stuff that goes in there. People put sugar and cream in there. And I find that if I'm not careful, people will quit my program before quitting the cream and sugar in their coffee. So I that's been my experience. That's
You mentioned stuff.
I,
I have a question. You mentioned something about, and she talked about it. We've heard people say eat 4 times a day or eat 2 times a day, and cut your meals down to small portions and eat it over a regular period of the day, or don't eat after 6 o'clock at night.
yeah, so in theory, if you eat many small meals instead of 3 large meals, then you won't get such a big spike of blood sugar after a big meal because your meals are small. So it spreads the blood sugar evenly out over the course of the day. And then on the other hand, we hear more and more about intermittent fasting, and you shouldn't, let's not eat until dinner time or something like that. And of course, you're going to eat a big meal during the times that you're not fasting, right? But in my experience, what matters much more is the types of foods and the portion sizes rather than the timing of the meals. And so personally, I spend very little time trying to talk people out of breakfast or into breakfast or really messing with the timing of their meal. I want them to let their appetite be their guide. I'm much more concerned about getting the starch way down.
And Heinz has a question. Can you unmute Heinz?
Yeah, I put it in the chat, but I've been reading on statins and that they could lead to diabetes. Now, I'm lucky I don't have it or pre-diabetes, but I'm on statins. Have you seen that happen, doctor?
Yeah, that's a great, very important question. So, about an hour ago, I said I stopped prescribing medications like 20 years ago. And I believe in medications and I believe in statins that for many people, it lowers their risk of artery disease and helps clean out the arteries. In my opinion, everyone who has peripheral artery disease should be on a statin unless there's a reason not to. Having said that, statins raise the blood sugar on average 4%. I think the research is very clear. And so for someone with prediabetes, it raises it a little bit. And for someone with type 2 diabetes, it might raise it, up to even 5 or 10, blood sugar points potentially. But I think there's good research and consensus that the small, relatively, that 4% rise in average blood sugar is worth the payoff that you get in terms of reduced plaque in the arteries. And I would never want to convince someone who's already taking a statin to try to reduce it for the sake of improved blood sugar control. Great question.
Thank you. Thank
Can
you
I
very
ask
What
much.
do you think
Well,
about the
today-
clinical studies on Ceylon cinnamon? We have one vascular surgeon that when he does prescribe a statin, he actually also prescribe, well, you can't really prescribe, but he suggests to the patients to go to their local supplement store and, get Ceylon cinnamon capsules and use those 2 weeks on and then 2 weeks off, because there are clinical studies that show it can potentially have an impact on A1C and help to keep that regulated. What are your thoughts?
Yeah, I was just looking at that about 6 months ago because the Huffington Post wanted to do an article on cinnamon and they included me in there. So you can look for that online. And what I found in the research was, yeah, there's something to be said about cinnamon. And there's enough small studies to show that, Ceylon cinnamon, can improve, blood sugar and cholesterol levels a little bit. And so I have cinnamon every day in my morning beverage, and it's good, but cinnamon's not going to save us, of course. And I would estimate that cinnamon can lower the A1C by an average of 0.1.
So at least it lowers it a little bit. Um, but you should make sure you do ask your doctor, or nurse practitioner, or someone on your care team before actually, taking those Ceylon cinnamon capsules. But there are studies out there, and then you can bring them in and have them help you determine if it's right for you. Marcia, I did interrupt you, so go ahead and ask your other question.
Well, Heinz was asking you about statins, and I thought that was real interesting. If post-diagnosis of PAD, if you have been able to lower your cholesterol and your triglycerides, I mean, I've done an overhaul on everything through diet, exercise, and smoking cessation. Is it always critical to stay on statins if by lifestyle you have reversed a lot? Or is once the plaque there, it's there to stay?
So plaque can shrink and stabilize and improve. And Dr. Dean Ornish was the first one to really show that convincingly on a low-fat vegetarian diet. But I think all good eating strategies are likely to reduce the amount of plaque in the arteries. But statins do a better job than lifestyle. So let me compare that to, in diabetes, lifestyle is better than drugs. I'm not saying we don't need drugs for diabetes. I'm saying lifestyle is better. When it comes to peripheral vascular disease and plaque in the arteries, I can help someone lose 50 pounds, but it's not going to improve their cholesterol levels nearly as much as a statin would. And with good lifestyle coaching, I can help someone get their LDL down to like 100, but that's not good enough for someone who has known heart disease or peripheral vascular disease. We want that LDL between 50 and 70, and we need a drug to do that. I'm not saying everyone has to take a drug. I'm just saying there needs to be a good reason to not take a statin, in my opinion. And maybe a person just, we're all in control of what we put in our body. But I would say a person should have a very good reason to not be on a statin if they have known plaque in their artery.
And Sally has a question also.
Dr. Dansinger, I've heard, my son in February, he's 21 years old, and he was just diagnosed as a type 2, which the doctor actually classified him as. My first question is, where does it actually, or the cut over from pre to being classified as a type 2? Okay, so where does that border actually, where does it break from pre to type 2? And the other question related to that also is, we actually in South Africa, in the Southern Hemisphere now, we're going into the colder periods. And his levels was actually a little bit up. And because he had an infection, how does a diabetic actually control if he's not on medication?
Yeah, so I think I didn't quite get the first question. It was about going from pre-diabetes to type 2 diabetes?
Yeah, how do they classify that? I mean,
Oh, okay.
how do they classify that from one stage to the next stage?
Yeah, so the difference between pre-diabetes and type 2 diabetes is just by the blood test. And many years ago they drew a line that said if your hemoglobin A1C is 6.5 or higher, that's type 2 diabetes. And if it's 6.4 or lower, as low as 5.7, that's pre-diabetes. And if it's below 5.7, then that's normal. Or you can use blood sugar. And if your blood sugar is over 125 milligrams per deciliter, that's type 2 diabetes. So how can you control that without medication? So I do everything in my power to help people stay off of diabetes medications. That's a very different viewpoint from my stance on statins, isn't it? And for diabetes, if you can, most people with type 2 diabetes, there's a weight that they can reach that is going to put their diabetes into remission. Remission, I would say, is normal blood sugar or nearly normal blood sugar without medication. And for most of my patients, on average, they're about 35 pounds above their remission weight. And with prediabetes, if you just lose 10 pounds, you can delay that pre-diabetes from progressing by like 5 years. Or let's say on average, if you have pre-diabetes, you can delay type 2 diabetes by, every 2 pounds you lose might be enough to delay diabetes by a year or so. If you could lose 10 pounds, you might delay pre-diabetes by 5 years.
And to control the infections like with the flus, because I mean flus and infections actually rise your sugar levels. How do we actually, or how would he actually control that?
Yeah, the infection, you're asking about the infection risk. So people with type 2 diabetes get more than their share of infections because their blood sugar is high. So they get a lot of they get dental infections, right? They get much more of their share of dental issues. They can get bladder infections, pneumonia, or many different types of bacterial infections because their immune system is impaired by high blood sugar. But if you can lower your blood sugar to normal, you can pretty much neutralize your infection risk. And the reason is the white blood cells are kind of blinded by high blood sugar. We need our white blood cells to work properly to clear bacterial infections. And so, if you can just normalize your blood sugar and get a hemoglobin A1C close to 6, that pretty much minimizes the risk of infection down to almost to the normal levels. Of course, I recommend the pneumonia vaccine and all the ways to prevent infections.
You bring up such an important point because we do have vascular specialists who will tell our patients that your sugar is really high. And if we do a procedure now to open up your arteries, whether in a minimally invasive way with a simple puncture or a grander incision, you are at greater risk of one, a quicker reocclusion, and number two, of infection at the incision point. And even with, if it's bypass, for example, a graft that they potentially put in. And so now I'm understanding why. And I think that that was a really great explanation. And I wonder if a lot of the infections that we see might be in part due to someone's high blood sugar. And I don't know if there's any studies, I'm going to have to go look to see if that's the case and how much of a role the high sugar may have played in the susceptibility to that infection.
Oh, yeah, absolutely. So I think it's just common knowledge among doctors that high blood sugar kind of blinds the white blood cells from being able to see where the infection is. And imagine an ambulance that didn't know where to go, right? And because they can't see out their windshield or something like that. And as soon as the white blood cells can see where to go, then because the blood sugar has gone from high to normal, it can make a really big difference in someone's healing and their incisions. And so even if someone has high blood sugar, a month before their a planned surgery, spending a month trying to get your sugar under very good control is time and effort that's worth doing, because it can make a very big difference about how you do during a surgery and your recovery afterwards.
If you are not having an acute or experiencing an acute, potentially limb-threatening or life-threatening situation when it comes to that complication of PAD known as peripheral artery disease, should you advocate for yourself with that doctor to say, hey, I know you want to have a procedure. I want to have a procedure. It's going to bring me so much relief. But is it worth working with a dietitian right now to bring down my A1C, or even going on some medication to accelerate that process to bring down my A1C prior to having any sort of procedure?
Yeah, you ask a great question, and unfortunately the answer is not simple, but it depends on the patient and the situation and the doctor and what's realistic. But I would say the way a person can dramatically improve their blood sugar in the course of a month by making dietary changes. So if a person is in a position to go from eating very much better over the course of a month because they're getting ready for surgery, that go for it. Yes. And if it's not an emergency, if it's an elective procedure, and if the hemoglobin A1C is like 9 or 10, because their blood sugar is so high, let me rephrase that. If someone's blood sugar is running like 200, 300, 400 much of the time, if there's reason to think that you can get their blood sugars closer to 100 or 150, I mean, do everything in your power to do that. And for many people, it's a matter of just not eating figuring out how to eat foods that aren't starch.
Yeah. Just my last question. My last question would be, what would be a safe range for a diabetic or type 2 diabetic to keep the glucose levels at? What range would actually be safe for them, instead of telling them to slam it down to something like 5.5, or what would be a safe range?
Yeah,
I think that's a great question, but it's, as you said, it's going to be a step by step, and for each individual, it's going to be different. But I do want to say, before you get into that answer, is my understanding is even one sugar molecule can wreak havoc on your entire body. It can scratch the artery walls, and allowing for those small LDL particles to eke in there and create trouble and push that wall out, right? And create some damage. But every little step helps, right?
Yes, absolutely. Good point, Kim. So if you're trying to get an A in diabetes, right, you want your blood sugar to be as close to normal as possible. I'd like to see it staying, between 100 and 150 most of the day. And if anyone has access to a continuous glucose monitor and you can track your glucose, over the course of the day, if it's staying, in that range, that's pretty good. But more important is, if you're, not everyone can go from getting an F to an A, right? And so, going from an F to a C, or going from a C to a B is valuable. And so when a hemoglobin A1C close to 6 is really, I think, what you want. And you don't want to have to use a ton of medications to get your A1C to 6. You want to be able to use lifestyle to get your A1C close to 6. And, if your A1C is 9, see if you can get it to 8 or 7, so as
Go ahead,
close
Marcia.
as possible.
Yeah,
Thanks.
you keep talking about A1C, and my tests don't say that. They say EAG.
Yes.
So
Okay,
how do we convert that, or no?
Okay, so there's a mathematical equation that relates the two, and you can easily find that online. So you can convert an EAC to an A1C. It's just a mathematical formula. They're saying the same thing.
And another, a quick question. You just said, maybe answered, but you said continuous glucose monitor. So I have never been told to monitor my blood, and so I don't know anything about it. I would like to be proactive and do that. Do you recommend it as pre-diabetic?
So right now, the people who have the best access to continuous glucose monitors, and you might have seen people who have one on their on the back of their arm. These are, they're about the size of a quarter, and insurance covers that for people who are on insulin and maybe some other people who have diabetes but aren't, their blood sugar's not in good control. And then you need a prescription for a continuous glucose monitor, but a person can pay out of pocket for that if their insurance won't cover it and if they have a prescription. So it's running around $100 a month on a, give or take, to have a continuous glucose monitor. But I think in the years ahead, more and more people will have with prediabetes will have access to continuous glucose monitors at a more affordable price, but insurance is not gonna pay for that.
What about the finger prick? And should I do it? And if so, what kind do you recommend?
You need a prescription for blood for pricking your finger, and most doctors would be willing to write a prescription for people with type 2 with diabetes, or potentially with prediabetes. That's a conversation you would have with your doctor. And yeah, if you're, if you explain to your healthcare provider how it would make a true difference in you, it can't just be curiosity, right? It has to affect your behavior for them to say, okay, I'm convinced that it's so. But I would expect it in a few years ahead, they'll have watches that you can buy that help you monitor that kind of thing. And so we're not quite there yet. It would not be typical for someone with prediabetes to be checking their blood sugar. There's many different types of monitors. They all have, pros and cons. I'm not in a position to recommend one in particular.
And Nancy has a question. Nancy, do you want to jump in with your question that I see that you have over on the right-hand side? Go ahead and unmute. Whoops, we can't hear you. Go ahead and unmute. There you go.
Got it. Okay. I'm a 25-year diabetic. Over the past 25 years, I have had, coronary artery disease, a heart attack, and now peripheral artery disease. I've been working really hard on myself for many years. I was able to get, I was 8.4. I got it down to 7.4, my A1C. Then I got it down to 6.2 last fall. And then I went back up to 7 over the winter because I guess I was in the house more, and I had 4 surgeries last year. I'm sure they affected it too. My endocrinologist feels that I can never really reverse diabetes, but I was able to get it down to 6.2, and I'm back on track now. I eat healthy. I walk 8 to 10,000 steps a day. I am doing everything, fighting hard. Is there, I'm sorry. Okay, let me get back in.
You're here.
Okay. Is it possible to reverse my diabetes? That's my goal all these years has been to never go on insulin. And I've been able to do that. I am on Ozempic.
Yes. Okay. So let me point out that you have type 2 diabetes and not type 1 diabetes.
Right.
And there's not a cure for type 2 diabetes. And when I say reversal, what I'm talking about is making lifestyle changes to get as close to remission as possible.
Okay.
So I think most people, when they talk about diabetes reversal, would agree that what we're saying is trying to get your blood sugar to normal with no medications. So about a third of my patients who have stuck with me for 3 months, have gotten their diabetes into remission. So their hemoglobin A1C, my definition of remission is an A1C of 6.0 with no medication.
Okay.
Now, some people are just never going to get there no matter what. For some people, the window of opportunity for full remission just does not exist because they're not biologically capable of achieving that. The longer someone has had type 2 diabetes, the harder it is to get into remission. The higher their A1C is to begin with, the harder it is. The more drugs they're on to begin with, but hope is never lost. And to me, reversal means doing the best you can to get as close to remission as possible. So to me, reversal is a behavior, not an outcome. The outcome is trying to get as close to remission as possible and seeing the reduction in A1C. And so we can, in the same way that we can reverse heart disease, meaning you can improve plaque in your arteries and prevent another occurrence of heart disease. We also talk about reversing all sorts of diseases. It doesn't mean they're cured. It means someone is trying to get it completely neutralized. And yeah, like I said, about a third of my patients have been able to achieve remission. And that's the kind of doctor I want to be, is helping someone who never had any, they didn't even know that it was possible. And to help them understand that, I could say, I think you're about 40 pounds above your remission weight. And let's do everything we can to try to get there. I've done it with many people. And then a patient starts to believe and they put in the work if they know that they can do it. So,
Douglas?
Yeah.
Yeah. So we talked about let's talk about food. I hear the word carb. We're supposed to have this many carbs a day in this diet or that. So if I have this amount of carbs, how much does that turn into sugar? Does that affect? So is there a particular food? Is there a certain amount of carbs? Is there a way to tell daily what I should be doing, what I shouldn't be doing?
Great question. So let me say there's many different eating strategies. They all have different rules. There's low fat eating strategies to reverse diabetes, and there's low carb eating strategies, and there's everything in between. So even though there's strategies that really minimize the fat rather than the carbs, I tend to favor the eating strategies that go after the carbs. And so there's opinions differ and there's many different eating strategies. And so I'm not going to say that you should stop eating apples. Some people would say, an apple a day keeps the doctor away and you want plenty of fruit. And others would say, no. Fruit is a problem. And because there's sugar in it. And so I cannot, until I'm working with an individual patient, until I know their food preferences and their, what they like to eat and what they've tried before, I would hesitate to personalize an eating strategy. But I will tell you this: starch is the same as sugar. Starch is made of sugar molecules. And when a person eats starchy food, and the main starches are, bread, pasta, rice, potatoes, anything made of flour, those are the main cereal, pancakes, waffles. These things turn to sugar within an hour after eating them. And for people who are fighting high blood sugar, it's like pouring gasoline on a fire. So, sorry, my answer is not quite as is so vague, but
Would that depend on, like, I'm an average size, so if I lose 10 pounds, I'm gonna get skinny. I don't have so, but it's the eating part that I want to help with my PAD. I also have CAD, and so it's the
So
eating habits that I'm learning now. The blueberries, because I
yeah,
still like meat. I do like meat. Well, I like chicken, but they're telling me not to eat any red meat or any of that. So
I think
it's
Kim's book is a good starting point with the dietary advice in there.
Yeah, I think it really kind of crosses across, all the different strategies and really gets down to, just substitute this for that, right? It's just little by little, one step at a time, which is so important. I do have a question that came in from someone online, though, if you don't mind. And I'm going to pull that up. It's from Miranda. And she asks, is it about the amount of carbs that is consumed? So this goes along those lines. Is it about the amount of carbs that is consumed in one's diet that turns into sugar through the digestive process that is the actual problem?
It's a great question. So I'm going to say the short answer is yes. It's more complicated than that, but I mean, yes. So the body the body turns starch into sugar. It happens. Let's just use a piece of bread as an example. So if I eat a piece of bread, it's going to turn to sugar in an hour in the intestinal tract. And if you eat a piece of bread, the same is true. And I don't have to know you to know that, if you eat a piece of bread, it's going to turn into sugar in the intestinal tract within about an hour. And then that's going to get absorbed into your bloodstream and it goes to the liver. And the way the liver handles that sugar, it's glucose at that point. The way your liver handles that sugar depends on you. And it depends on whether you have diabetes. And so that liver is going to store some of that glucose in its, inside the liver cells and release it later. Or it's going to send it off to the rest of the body to feed the cells, or it's going to turn it into fat. And whether it's going to turn that glucose into fat or whether it's going to release it into the body sort of depends on a lot of factors. It depends, but it turns to sugar. And how much of that sugar is going to get into your bloodstream and how much is going to turn to fat sort of depends on the person.
And it depends on how active you are, right? Because especially when you're younger, you have kids that end up, they just consume carb after carb after carb because they're burning it really quickly. And so is that also the same difference as an adult? The more active you are, the more carbs you can eat and that your body needs.
Yeah, that's right. So we all have sugar in our blood. And some people have insulin resistance, meaning it's going to be difficult to get that sugar out of the blood into the tissues. Other people are insulin sensitive. Teenagers, especially athletes, they're all insulin sensitive. It's easy to get the sugar out of the blood into the muscles. And so it's not going to build up as fat in the liver. But if you have insulin resistance, if you're not insulin sensitive because of obesity or type 2 diabetes, a lot of that sugar that's in the blood is just going to be stored as fat in the liver. The liver says, oh, there's already plenty of sugar in the blood, and just here's more sugar coming in from the gut. I'm just going to have to turn it into fat.
Yes, Linda. Linda, you have a question. You made it on.
I made it on.
Fantastic.
Oh my gosh, I'm so challenged with this technology stuff.
You did great. I'm so proud of you.
Well, it's only taken me weeks.
But you're here now. What is your question, or do you have multiple questions for Dr. Dansinger?
Well, I'm actually thrilled to be on this one today because I was just told I was pre-diabetic about 2 months ago at 6, exactly 6. my A1C. And so I've been fairly rigid until I realize I'm probably eating too much fruit. How bad is fruit compared to the, the bad carbs? I always think of fruit as the good carbs.
Yeah, that's a great question. So in the eating, I said there's many different eating strategies with different rules. And so it depends on the eating strategy. But in the one I use with most of my patients, I would say I'm not that worried about fruit. I'm worried about starch. So fruit is good for weight loss, you see, and there's lots of benefits to fruit. And personally, I don't even get into which fruit is better. And yeah, worse fruits might be pineapple or banana or grapes, for example, and better fruits might be berries and maybe citrus or peaches. But I'm much more worried about starch. It's just it's like 3 times worse than fruit, and so I don't
I
see
don't have much starch.
right.
No,
So
I don't eat starch.
But that includes starchy vegetables, right? We were told only to have 1 potato per week, for example.
I hardly eat a potato anymore.
right.
I love them, but I won't eat them now.
So the main way to get that A1C out of the pre-diabetic range. So your A1C is 6. Pre-diabetes goes from 5.7 to 6.4. You want your A1C out of that pre-diabetic range. You want it to be 5.6 or lower.
Okay.
And the best way to do that is to lose any excess body fat.
Did that.
And so you have no fat to lose, right?
Nope.
Okay.
I've lost 12 pounds since January. So
excellent.
I might be at that point already then, hopefully.
So if you're eating almost no, bread or things made of flour and rice and pasta and
Very little.
white potatoes, then if you need to make another move more aggressively with your eating, then and only then is when you would usually say, all right, well, let's go after the fruit then and limit it to 1 serving a day of berries, if you need fruit at all.
Okay, that's
Body
great.
only needs vegetables and lean protein to survive. You don't need fruit to survive, but I hate the idea of having to go a day with no fruit unless it's absolutely necessary.
Well, this was a great show. I love the numbers. The numbers really help guide us, I think, more than just saying, don't do this, don't do that. If you know numbers, it really helps.
Okay.
Dr. Dansinger, what would be one of your no-nos that you like?
Oh, okay, I'll share with you.
You're non-negotiable.
No, so,
You're cheatery.
I love the taste of unhealthy food, like most people do. And my wife makes these chocolate chip cookies, and she also makes this cake. And when it's around, it's irresistible and it beats my willpower. And so, I would say chocolate chip cookies are practically irresistible for me. And the best way I can avoid them is by not having them in the house. And
you know what I do is me too. I love them. And so I got this I went and read the backs of the packages of all these different cookies. I found this one that's paleo and it uses almond flour and it has very few ingredients in it and you have to add things. So you add, like I use a farm fresh egg from our neighbor's farm. And then I also use natural either coconut syrup, from the coconut sap, or I'll use a raw, maple syrup that doesn't have anything in it straight from that's actually in bourbon barrels. And then I use the HU chocolate, which uses what's that different sugar from the monk fruit? Monk fruit,
Yeah.
sugar in it. And then I add a lot of walnuts, as many walnuts as I could pack in there. I know there's a little fat in there, and so for some, that's not a good idea. But if I'm going to have it, those are craveable. I absolutely love them. Are they healthy? No. Are they healthier? Yes. And are they still delicious? Yes. So I've found ways to get around it because also I'm allergic to dairy. I'm allergic to gluten so much. And actually, if you're on Instagram, I just discovered there was an amazing recipe for cake that was like raw cacao, apple, and I think it was just almond flour or something. And there was just like few ingredients. And I don't know what it tastes like yet. I'm going to try it. But I think that going on Instagram and following all those healthy people is really a fun way to try new things that are healthier. And I have one more thing. I just did a video, Dr. Dansinger, which you'd appreciate, which actually worked. I had to try it myself. We have this new series we're doing called Patty's Plate, like our, the Patty's book. So we're bringing it to life called Patty's Plate. And it's non-professional. You can't be a real chef. You have to be a real home cook and, do things the way a normal person would do it. So I went in and I tried this recipe I got off Instagram for a bread alternative, whether you choose to have whatever you choose to put inside your sandwich, whether it's a grass-fed bison burger or whether it's a marinated roasted mushroom with onions and, pickles on it. I have a new bread alternative, which I'm addicted to, and it's avocado. So you mix avocado with an egg and some salt and pepper and garlic. And I use this oat milk cheese, which has very few ingredients, not a lot of fillers. And I put it in the oven and it makes really good, tasty bread that actually works. I was shocked.
Wow.
Absolutely
That's
shocked.
amazing. I love it.
Simple ingredients and all natural. I thought you'd be proud.
I am proud.
And I find that the chocolate chip cookie thing is it's just one of those things, isn't it? And my neighbor brought me we got a deer. My neighbor brought me some more deer meat, and you mentioned that because she left these for me, 2 of them. And it was like, I don't want to eat them because I know they're not good for me, but
But you can have one, right? Every once in a while, as long as you're not like, oh, I'm going to cheat and I'm going to have that one chocolate chip cookie, but then I'm going to have the Dr. Pepper. I'm going to have the chips. I'm going to have as just, one after another, right? Dr. Dansinger, it's like, okay, pick your non-negotiable and that 90% good, 10%, okay, you can cheat.
I've been using the 90% rule with my patients for 15 years, and I think it's held up very well. And people understand what you're talking about. People say, that it resonates with people. It makes sense. And how you use your, 10% treats is the same as 90% strict. And how you use those treats differ person to person.
And I have one more question, and then I know I don't want to take up your whole day, Dr. Dansinger, maybe if someone else, just to finish up with other questions, but you touched on it a little bit, but I want to drive home this point because I see this often that when someone is diagnosed in many cases with the type 2 diabetes, the first inclination, especially since we're seeing a big push on television and the pharma reps visiting these doctors, we're seeing more and more, physicians actually prescribing the Ozempics and all of these others, these quick fixes, and then also the general insulin before trying anything else. For the patients out there that are advocating for themselves, what would be an indication to that patient that okay, I should go on these medications, I should go on insulin, two separate things, or or do I have time and the ability to actually try a lifestyle modification myself, get that exercise up, get the diet in check, get a referral to a dietitian or a program like yours? What's that indication that
That's
the
a
patient
terrific
should know?
question. So
Yeah.
I'm going to oversimplify it by saying no matter how high your A1C is, and I would use the A1C to guide, no matter how high your A1C is now, there's a good chance that you could get it below 7. And if you can get it below 7 without medication, I don't like to start medications if the A1C is below 7. And if you cannot keep it below 7 without medication, despite all your best efforts to lose weight and to eat right and to exercise, if after 3 months you're just not able to budge that A1C anymore and it's going to stay above 7, that's the time. Don't wait any longer. Don't pray for, don't pretend that it's just going to go down on its own. If you're not able to do more on lifestyle and you're stuck above 7, that it's important to start medications at that time. But if a patient came to me and their A1C is above 7 and they say, I want to do everything I can to lower it through lifestyle, I wouldn't start drugs at that point.
And for those that are on the insulin as a type 2, is it possible to, and what would it take to actually get off of that?
Yeah. So how do we discontinue drugs? That's a great question, including insulin. So first I want to get the A1C close to 6, right? If we can't through lifestyle change get the A1C close to 6, then I wouldn't reduce any medications. But as the A1C gets close to 6, 6 to 6.5, then that's the time to start reducing medication. So, of course, I want to lower someone's insulin dose first, and then, see how low we can get the insulin. And if you can keep your A1C, close to 6 with half as much insulin, great. And if you can continue to lower the insulin till it's gone and still keep your A1C around 6.5, great. And then the next drug, maybe it's the glyburide or the glipizide to go next. Or if you're not on insulin, but you're on, glipizide or glyburide, that's the first one I like to get rid of because that can push the blood sugar. I mean, that's that. And these weekly injectables, the Ozempic and the Mounjaro, I think I like those drugs. And they're for people who can't get their diabetes under control through lifestyle change, but it helps people lose weight and it's a good complement to lifestyle change. And so it's another great conversation to have that we can't get into too much detail here.
Joshua has a question. Joshua, you want to unmute and ask?
Hi, doctor. What's the turnaround time for a grade A patient from 7 to 6?
Oh, 3 months. 3 to 6. I mean, there have been dozens of times where I've helped a patient get from 7 to 6 within 3 months.
And
That's excellent. Thank you, doctor.
And Robert has a question. He has a series called Pad Life Outdoors. He's a peripheral artery disease patient. And he wants to know what advice you would have for a diabetic patient who is trying to get their exercise in. They schedule a long walk, a long hike. What is a really good snack for them to bring along with them that's portable and satisfying?
Great question. So a small amount of nuts can go a long way. they're portable, they're light. You can do that. Jerky, like turkey jerky, for example, would be another good one. I'm not in love with protein bars, but because I wouldn't consider them like real food, but there's a potential place for those. Some people might carry a hard-boiled egg, with them. We're looking for things that are portable, don't need refrigeration, are tasty. A bag of carrot sticks would be another, or celery or something like that. I'd love to hear other thoughts.
What I do is I bring some I actually make, once a month, I make these little small baggies of some dried wasabi peas, and a wide array of nuts. And I just do a handful, put it in the bag so I can take it and go, along with a little baggie of just a few berries, blueberries especially, that I can take with me. And then I have the protein and the berries.
Love it.
I cut up vegetables and I take them every day with me to that. So when I'm at the gym and I get really hungry,
yeah,
I have asparagus. I do it in my this is a blueberry container.
Yes.
So I fill it up with carrot sticks, whatever I have, green beans. Well, the green beans are steamed asparagus, and the sugar snap peas. Are sugar snap peas high in sugar?
Not so much. I mean, it's much less than fruit.
Right.
Despite the name.
Okay.
There's a lot of fiber in those too, so I never worry about that.
Yeah, well, I eat the whole thing. As soon as I come out of the gym, I eat my whole blueberry container.
Any other
What are
thoughts on
your
that?
what are your thoughts on honey, doctor?
Honey? Not good, not good. So, honey, is honey better than other forms of sugar? Most scientists would say, well, your body can't tell the difference between, between different types of sugars. And so a teaspoon of honey or a teaspoon of agave or a teaspoon of high fructose corn syrup, the body can barely tell the difference. Having said that, I think honey is a good condiment, and condiments are for making healthy food more exciting and appealing. And so I would actually encourage people to use a little bit of honey when needed to add excitement to things like plain yogurt or other healthy foods that could benefit from just a little bit of sweetness. So I think there's a place for that sort of thing, but it's sugar. And so your body treats it like any other kind of sugar.
What do you think about artificial sweeteners?
Great question. Do we have time?
Because I just started using them when I became pre-diabetic, but I know they're controversial. So
artificial sweeteners, in my opinion, are better than sugar. So is a Diet Coke better than a regular Coke? I would say yes. Is a Diet Coke worse than water? Yeah. And so, I think stevia, I wouldn't even call that an artificial sweetener. I would call that a natural, calorie-free sweetener. That would probably be the best one. A lot of people don't like the aftertaste of that. And then, the American Diabetes Association and most mainstream nutrition authorities would say there's not that much research to say that artificial sweeteners are much of a problem. And you'll get some experts who have very strong feelings against them and say that's probably worse than sugar. I mean, they are made in a laboratory, and no one would be surprised if we learned down the road that they're worse than we realize. And there is some research to say promotes insulin resistance. It's not good for your intestinal bacteria. Is it better than sugar? Probably. I mean, we should all. So, but if it helps you reduce your sugar intake, I think that's it. So I have mixed feelings, and I would say there's a middle ground when it comes to artificial sweeteners. It's not the worst thing, but
Right.
it's
I mean,
not
if
the
you
best
need it for
thing.
your coffee to transition, then I mean, I had to with my lattes, I had to go from 4 pumps of vanilla in it. And then I knew I needed it in there, but I needed to gradually get myself off of the sugar. And now I just drink plain coffee, fresh ground, no matter what. I don't want anything in it, actually. It tastes really weird with any sort of sweetener. But I'm curious, I was a big fan of monk fruit sugar. And then I discovered that now, before it seemed pure, but now they're putting in, is it erythritol, which I'm concerned about even the name and its potential to cause harm because it's manufactured, I would imagine.
Erythritol is a controversial sweetener, but it wasn't very controversial a year ago. So monk fruit, right? There's an extract of the monk fruit that's very intensely sweet. Let's say it's 600 times sweeter than sugar. And you can't just put monk fruit extract into a packet because it would be so minuscule that you wouldn't be able to see it there. So they mix the monk fruit extract with other stuff so that you can fill a packet of, like, you've seen a packet of monk fruit is 99% erythritol and 1% monk fruit extract. And much of the sweetness is coming from the monk fruit extract because it's so intensely sweet. But to add bulk, they use other sweeteners, especially erythritol. So erythritol is absorbed and then into the body, and then it leaves into the urine. So you excrete erythritol in the urine, and until a year ago, no one could find any problem with that, any safety issue. But about a year ago, some researchers found that it can slightly raise the risk of blood clotting if you are already prone to blood clots. So, for example,
Good
if
to
you
know.
have peripheral artery disease, the last thing you need is to raise your blood clotting risk. And it's a dose related. So the amount of erythritol, which people are getting from monk fruit packets, or just using erythritol as it's not that rare of a sweetener. It might raise the risk of clotting slightly. So for a regular healthy person, it's probably a non-issue. But for someone with peripheral vascular disease, I'd stay away from erythritol, which means they should avoid monk fruit because that's really mostly erythritol.
Good information. I want to get just one more question in from Nancy. Nancy, what's your question? Oops, Nancy, up there you go.
Okay, I just unmuted. Yeah, I have always been addicted to drinking milk. So I went down to 1% milk, and I try to limit myself to 1 or 2 small glasses a day. I also went to plant-based butter instead, that I like. And also I use something called RX sugar, which is an allulose, and it's right here. And it's supposed to be low glycemic. It's sugar reimagined, 0 calories, net carbs, glycemic. I use like maybe a half a teaspoon in my coffee. So how about those things? What are your thoughts on? I'd be interested to see what the doctor thought about those.
That's a loaded question filled with lots of different
I'm trying
balls to drop.
It's hard. I've been a diabetic a long time. So.
Remind me the first part of your question, please.
Well, dairy. How do you feel about dairy?
Yeah, milk. Okay, so just quickly on milk. I grew up in Minnesota, which is a dairy state, and I drank milk with breakfast, lunch, and dinner. And they served it at school lunch. And later we learned, also in Minnesota, that dairy fat is a high risk for heart disease. And so once they figured that out, they started promoting skim milk, which I have mixed feelings about. So once you take the fat out of dairy, I think it's healthier, but there's protein and lactose sugar combined in milk. So a cup of skim milk is maybe 90 calories, and you could drink unsweetened almond milk, for example, or cashew milk for 25 or 30 calories per cup. So it has a third of, unsweetened nut milks have about a third of the calories. These are the commercial nut milks, not a homemade nut milk. And they have calcium in it and vitamins. And so I think a glass of milk, like skim milk or 1%, is perfectly fine. I would usually not steer a patient away from having a glass of skim milk a day, but I wouldn't say like 3 cups a day like I used to drink when I was a kid. And there's something to be said, I think, for these commercial nut milks that are 30 calories per cup. I think they have a place. So milk's all right.
What about plant-based butter?
Yeah. Well, okay, plant-based butter is healthier than regular butter because of the amount of dairy fat, right? So butter is pure dairy fat, which clogs up the arteries, no question about it. But these plant-based butters, it matters how liquid it is. And so when it comes to fats, the main thing to care about is how solid is it at room temperature? And that's, I think, the same question as what's it going to do to my arteries? So if a fat is liquid at room temperature, like olive oil, then it's better than a plant-based butter, which is solid at room temperature. And plant-based butter is better than regular butter, but it's not as good as something that's softer or more liquidy, like especially oils. So they make this plant butter by adding like coconut oil, which is, going to be solid or semi-solid at room temperature. So that's how I think about it. How liquidy is it at room temperature tells how it's going to treat your arteries.
Okay.
I have a question. How do you feel about now I use a ton of olive oil thanks to Kim, and they have the store I go to, they have all these flavored olive oil. So they have butter flavored olive oil. And of course I love butter, but can't eat it. How do you feel about a flavored? Because I don't know what it's flavored with.
So it's probably not flavored with actual butter, because
Right.
that would sink to the bottom or rise to the top. But there's some chemical that is buttery flavor. It's probably also in that movie popcorn. And
Right.
We're often eating foods that have flavorings in them, whether it's low sugar yogurt, or whether it's a lot of the foods that come in packages have artificial flavors in them. They're probably harmless, and adding a little bit of butter flavored chemical to oil is not ideal, but we all want our food. We want to enjoy our food, right? And so if you use what I call the condiment principle, right? Sometimes a little small amount of sugar makes, something more appealing, or a small amount of salt makes something more appealing. A little bit of cheese makes a salad more exciting, and a little bit of butter flavor to the olive oil. Sometimes, I think there's a place for that. So I'm not going to say anything real negative about that. I think other people would say, ugh, why would you ever want to do that? But I think there's the middle ground has value. So that's my that's my that's my that's my
There's some school of thought that there's some school of thought, you know, that traditionally there are these heart disease reversal books that say get rid of all the oil. Oils are bad, 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 bad. But I think what they're talking about is really the store shelf oils, that many of them are rancid and they lose, you know, that antioxidant quality of you know, early harvest, hand-picked, cold pressed, you know, olive oil that you might get that's in limited production and more fresh. We do have a couple of cardiologists and one vascular surgeon that literally prescribe a tablespoon of olive oil before the 3 main meals of the day. If you're using a very high end, you know, highly antioxidant rich olive oil. And that's something that actually my dad and I do now as well. And it was able to clinically lower he was very high in inflammation. And just that act, coupled with a turmeric extract capsule, seemed to lower his inflammation in his body.
You've seen the proof with your own eyes, Kim, and there might not be convincing research studies that show that prescribing, you know, a tablespoon of olive oil a day does that. But what all the research studies that I've seen show is that is that the type of fat you eat makes a very big difference in your risk of artery disease. It's one of the most important things when it comes to protecting your artery, is that ratio of unsaturated fat to saturated fat. And so by having more olive oil, you're raising the ratio, you're improving the ratio of healthy fat to unhealthy fat. There's a lot of research that shows that. So, but if you're trying to lose weight, having, you know, a tablespoon of olive oil or any other fat, it's going to be about 100 calories, and that can make the difference. So it's complicated.
Again, it depends on the individual. Dr. Dansinger, we really appreciate your time. Final thoughts and final takeaways.
Food is medicine, and right, it's better than pills. And part of one of the main symptoms of our healthcare system being broken is that doctors have failed to do their duty to use food as medicine and to remind us how the way we eat has so much to do with the way we feel, the way our bodies are. And it's never too late to use your food as medicine. The older we get, the more important healthy eating becomes and makes the biggest difference in how our brains work. And so, you know, I'm proud that, Kim, you've provided an opportunity for all of us to participate together. I'm proud to have been invited as a guest to what you've created, and I look forward to the next conversation.
Thank you. If people want to find out more about your program, if they are in Massachusetts or in Florida, what is your website that they can visit?
Yeah, so my website is called diabetesreversalpartners.com.
Diabetes Reversal Partners.
.com.
Fantastic. And do you have any sort of publications or any blog that they can follow? Or are we going to start a blog over on ours with all of your stuff? Our YouTube channel, give you a playlist?
I don't have a blog, and I don't have a book yet. And I am on Facebook and Instagram, though.
And
you need to come to Texas so we can get. You really do need to come to Texas so that we can get what I can't keep up with everything I learned today, but you need to come to Texas so we can work. I want to work with you right now.
Thank you
Next
for your
stop,
invitation.
Texas. Yeah, we do have a very big market there, so that would be a really good one.
Good
for
point.
you. But we do, if you want to actually read some of his thoughts in print as well, you can go ahead and go on Amazon and you can order the Food for Thought book. You can find it by searching peripheral artery disease, and you will see, there you go. Douglas actually is showing the book. Keep holding that up for 1 second, Douglas. Just go ahead and take a look. There's the Food for Thought book, and you can pick it up on Amazon. You can also go ahead and go to padhelp.org, and you can contact us if you can't afford to get the book. It's only $20 on there. It's mainly printing costs for Amazon. We don't really make money off of it. But if you need it for free, let me know. Go ahead to padhelp.org and message us through the website, and we'll go ahead and get you a copy. But it's also free online on that website. There is a simple booklet tab on there that you can go ahead and just read it online as well. Thank you so much, everyone, for joining us. And Dr. Michael Dansinger, again, we appreciate you so much.
Thank you.